Once you've determined that the area is safe, check for level of consciousness. If the child is unconscious, assume implied consent and tap the child and shout to see if the child responds.
Tap the child and shout to see if the child responds.
Open the child's airway and do a quick visual check for breathing for 5 seconds. Gasping breaths should not be confused with effective breathing. If the child is unresponsive and/or not breathing, call 911 and get an AED if available. If you are alone, provide 5 cycles or 2 minutes of CPR first, then call fast for EMS or 911. Carry the child to the phone if you are able. If you are alone, provide 2 minutes of CPR first before calling 911. Most children suffer respiratory-related causes of arrest. Therefore, early CPR provides the best chance of survival. If the child is gasping or not breathing adequately, initiate child CPR for cardiac arrest. To do CPR, place the child face up on a hard surface. Place the heel of your hand in the center of the casualty's chest, between the chest muscles, straight across from their armpit. Give 30 compressions, 2 inches or 1/3 the depth of the chest. You can use 1 or 2 hands to do compressions. If using one hand, maintain an open airway with the other. Open the child's airway and give 2 breaths. Open the airway using the head tilt, chin lift method. Give 2 slow breaths to oxygenate the blood now. When giving 2 slow breaths, keep the airway open. Seal the nose shut. Place your mouth around the child's mouth with a tight seal. Each breath should be given over 1 second with sufficient volume to achieve visible chest rise. Use a breathing barrier when possible. Avoid excessive or quick ventilations, as this may cause the child to vomit. Repeat cycles of 30 compressions and 2 breaths. When doing compressions, you should go at a rate of at least 100 compressions per minute. Keep circulating and oxygenating the child's blood. Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of life return: spontaneous coughing, breathing, or movement. The area becomes dangerous. An AED arrives. If the AED arrives, turn it on. Bare chest. Attach pads. Place 1 pad on the center front of the chest and 1 pad on the center back. The AED will analyze for heart rhythm. If a shock is advised, stand clear and say, "I'm clear, you're clear, everybody's clear," and push to shock. Continue CPR after shock delivery. The AED will reanalyze every 2 minutes. If no child pads are available, use adult pads. Place the pads as illustrated. If adult pads are closer than 1 inch apart, place 1 on the child's center front and 1 on the child's center back.